Faculty that you're going to hear speak today and give you a bit of a background, and also thank all the faculty who are really here based on a volunteer basis for the entire day, so I'm very grateful to all my colleagues. And as Mike mentioned, this is the multidisciplinary team that we work with, and I've tried to include people from across the city, so Sunnybrook has representation from a very well-known physiotherapist, Joanne Dorian, who helps with facial reanimation and, in general, wellness at Sunnybrook. So from the top, Dr. Timiansky is our chair of neurosurgery, and he is a senior surgeon who has the most experience in our group with resection of acoustic schwannomas, and many of you, as Lina mentioned, are familiar with him and have had interactions with him. Dr. Norm LePerrier is our senior radiation oncologist, and he truly, not because he's in the room, is the radiation oncologist I trust the most to go to for all complex cases that I have to manage, and he will speak to you about the radiation treatment for for acoustic schwannomas with gamma knife or fractionated. Dr. Kruzman is our colleague from Sunnybrook, who is a surgeon and operates together with his otolaryngology team on acoustic schwannomas. And the reason I've invited him to come here is that he has experience with the trial for ABI, and I hope that he can give us some information on that. Dr. David Potier is our otolaryngologist who will speak to you about vertigo balance management, and he has an app that he uses for correction of vertigo and balance, which I hope that he could demonstrate later during one of the breaks for you. Dr. Radovanovich, as I mentioned, is my colleague who is an excellent technical neurosurgeon and does acoustic schwannoma surgery, and he'll talk to you about some of the surgical approaches as well. I mentioned Miss Joanne Dorian, who I actually have never met in person, and if you're here, please raise your hand. No, but hopefully during the course of the day she'll be here. Catherine Morris is a new neuro-oncologist in our group who will talk about targeted therapeutics. I think this must be the cart getting set up. And I'd like to thank Ali Reza Mansouri, schwannoma, and he has helped organize the day with me. He will be the moderator for the session, and he'll explain to you the layout of the program and question periods, etc. So he has the opening talk for introduction and overview of vestibular schwannomas, and I'll ask him to come up to